A very good morning, good afternoon, bonjour, from wherever you're joining us. We are at 98 participants so far. It's 11 o'clock, 12 o'clock Nairobi time as we agreed to start the webinar on time. We're going to get started right away. All our panelists are online. I want to thank you all for joining us this morning. Welcome to this webinar on addressing disaster risk reduction to multiple hazards in Africa. Just before we get started, a few logistical issues for you to be aware of. Please note that all our online participants are on mute by default. Only our speakers are on video. We want to see their expressions. We want to see the passion that they bring to these discussions. So we're going to make sure that we keep them on the video throughout the conversations. There is, however, a chat box for all our online participants where we're encouraging all of you to enter those questions that you're starting to think about as the conversations go along. I want to thank everyone that's joining us across Africa, Asia, Europe. We think that the Americas are still sleeping, so we're gonna leave them alone for now. And hopefully maybe towards the end of the conversation, we might have a few people from the Americas region joining us. I particularly want to thank the expert of panelists that have joined us today. I mean, these are all such busy people. They're supporting their governments and communities in responding to COVID itself and other crises that they are facing within their country context. I want to thank them for taking time to come and share their pearls of wisdom with us today. My name is Tandy, and I will be your host for the duration of the discussions we have today. In today's conversations, we're going to hear about quite a spectrum of issues, from continental-wide cooperation and coordination on response, socioeconomic impact analysis of COVID, government coordination at the national level, community response to climate change-induced food security and floods. We're hearing COVID response and the job that frontline workers as national organizations are playing. So the whole localization agenda has been thrust into the spotlight. We want to hear about how you as organizations that are working on resilience are adapting to working in this context of lockdowns and curfews that most governments have imposed to ensure that the spread of COVID is curbed. And as humanitarians, there's a situation we probably don't even want to think about. What do we do as humanitarian and development partners if a situation emerges where international response is required? How does the humanitarian and development community organize ourselves? And in talking preparedness, we're asking questions on whether disaster risk insurance is paying off at a moment like this. But for now, allow me to turn to Amjad Abasha, the chief of the UNDRR Office for Africa, to set the tone for us in terms of what the disaster profile looks like for Africa, but also the policy direction we should be taking. Amjad. Amjad is on mute.
Good morning, Sandy. How do you copy?
We hear you good. Thank you.
All right. Thank you very much for this introduction, and greetings to you and my colleagues and friends who are also on the panel. I wanted to just start by, first of all, recognizing the complex situation we're in, not only in Africa, but of course across the world, and particularly, because of this COVID-19 issue. Now, when we talk about disaster risk reduction, even before COVID-19 came about, the disaster and the hazards that affect Africa are still there. They continue to be there. And we continue to face multiple hazards with or without COVID-19. So we need to keep our eye on the ball when it comes to this particular issue. As we speak, we have, Africa's undergoing locust infestations, floods, droughts. So last year we knew about the cyclones that affected the southern region of Africa. So the issue of hazards and their different nature remains a challenge for us in Africa. We've done some work and studies and to understand a little bit about what the risks that are occurring in Africa. And we know that 90% of the disasters that occur are really climate related. In the last 10 years or so, a report that we produced indicated there's about more than 700 disaster events that have occurred in Africa, affecting 157 million people. A separate report that we worked on a couple of years back indicated that we had at least 2 disasters per week that we faced in the continent. Now, this is a conservative figure because we still in Africa we still have a long way to go to optimize the data collection when it comes to disaster loss disaster losses on the continent. Now, the COVID-19 crisis is important, and in the sense that biological hazards have been recognized in the Sendai framework as a critical area to be addressed in the future. And this actually came about from a push by many African member states who based on their Ebola experiences at the time, insisted that biological hazards be part of the Sendai framework for disaster risk reduction. This was way back in 2015. So, it's nothing that is, it's something that was anticipated. The issue of biological hazard needed to be dealt with. Now, this COVID crisis demonstrates what many of us in the disaster risk reduction community have been talking about. And basically we're saying that risk is becoming systemic. In other words, risks can be embedded in the system. And a single disaster event such as the COVID-19 can really produce multiple complex hardship. And considering Africa's vulnerability to hazards, it can make disasters more deadly. The vulnerability is increasing because recently, because of this COVID, UNECA had produced a report that indicated that between 5 to 29 million people will be affected by extreme poverty because of COVID-19. So this basically increases the vulnerability of people to disasters and floods, droughts, and so on. So. It's important to also address the complex, understand the complexity of the crisis. And I just want to throw out 2 quick angles that I think we should look at. It is not inclusive or of everything, but I think it's at least a start for us to look at in Africa. First of all, we need to get stronger risk understanding and knowledge. For example, we need to work closer with the health authorities to carry out risk assessment, including those related to socioeconomic analysis, so we can inform policymakers how best to prevent, detect, prepare for, and respond to hazards, including the biological ones that we're seeing through COVID-19. And in this way, of course, authorities can take measures to reduce exposure and mitigate the vulnerabilities of groups who are decreased rates of getting infections due to any biological hazards. Related to that, we have to recognize that there are similarities shared between disasters and health risk management approaches and practitioners. For example, health practitioner and disaster risk practitioner could work together, joint efforts to conduct these risk assessments, carry out surveillance, set up early warning systems together. There are similar tools that can be developed. Work together on ensuring resilient infrastructure. By that, I mean focusing on hospitals and clinics. This is something that is one of the critical targets of the Sendai framework, is to ensure that we have clinics and the medical health services are resilient to disasters. And the other area that's important also within risk knowledge is to strengthen the risk information and data gathering to support decision makers in Africa. Disaster loss databases that UNDRR has been working on and the Sendai framework will monitor, which allows you to monitor progress you're making in terms of disaster risk reduction, offers some opportunities to track impacts of disasters. So we need to ensure that we have rich disaster loss databases and strong Sendai framework monitoring, and this can be helped through the support of resident coordinators, UN country teams who will work closely with the government to ensure that they have the information that is needed. Now, the second element that I want to focus on before I close is that the issue of risk governance. In sub-Saharan Africa, epidemics are recognized as a risk. Within this particular area, many countries in Africa, almost 2/3 of the countries are developing disaster risk reduction strategies to meet one of the first Sendai targets or deadlines, which is 2020, that all countries should have disaster risk reduction strategies. I think it's time to revisit those strategies, make sure that they do include biological hazards, and ensure that they're strengthened and inclusive in that way. In addition to these biological hazards that are included in disaster risk reduction strategies, we should also ensure that we learn from lessons that we've had in the past. I think there's some good lessons from Liberia and Sierra Leone from the Ebola, and to enable us to respond, improve better, and use those lessons learned in those national strategies. And finally, risk governance also means really overcoming siloed approaches and coordination mechanisms. So, as evidenced by COVID-19 pandemic, it's really important for us to understand the interdependence of the disasters, you know, the health, floods, drought, climate change, etc. And to do this, we need to communicate better across sectors, coordinate better across sectors, be they health, socioeconomic, agriculture, etc., and to make sure that we work together and coordinate our response. So I wanted to stop there. I think the last message I wanted to give is just, it is time to revisit disaster risk reduction strategies. It's important to strengthen our disaster risk management agencies and ensure that we take a whole of society approach that includes all actors, communities, Red Crescent movement, private sector, and others. So thank you very much. I stop there and hand over back to you.
Thank you. Thank you, Amjad. I do think you've really laid out the stage for us to dive deeper into those issues, and I'm glad that we have such a diverse panel of speakers that are actually coming from different angles to address some of those issues. To just pick up on literally the last issue you raised on the interdependency of disasters in Africa, and the sort of the picture that you painted to us in terms of the epidemics being recognized as a risk in Africa. You're looking at food insecurity, the vulnerability that is deepening because of COVID. It is quite remarkable, though, to note that of the global infections in COVID, Africa has only recorded about 20%. I understand WHO has Dr. Moeti's representative joining us as well, so they can also give context to these discussions. So with only 20% of the global infections manifesting in Africa, quite remarkable. The prognosis for Africa, though, is quite gloomy. It's almost apocalyptic when we read the papers and what is being projected to happen in Africa. If it spreads in the poor settlements where there's already issues of sanitation, issues of water, lack of access to basic health, it brings us back to the component of that interdependency that you described, Amjad. So I'm going to turn to Kai with the African Union right now to tell us exactly how the AU, being the continental coordinating body on politics, health, and all socio-economic issues, how are you, Kai, working with governments to ensure that there is proper coordination on preparedness efforts across Africa? If we still have Kai. We can maybe leave, Kai, I see Kai online. We can maybe leave that there. Kai, you're on mute. If you can hear us, please unmute yourself and hopefully get into this conversation. Yes, he's online now. So Kai, hopefully you understood the question around coordination with member states on COVID preparedness. we could be having technical issues with Kai, so I'm going to maybe leave Kai for now, and hopefully we can come back to Kai in a couple of minutes. I'm going to turn to the UN coordinator for Uganda, Ms. Rosa Malango, to perhaps give us an impression of the socio-economic impact that you've described, the analysis that Uganda is taking on. What does it look like, and what would response mean, given the kind of context that Amjad has described to us, the different issues that Africa is facing? Uganda is not unique in the sense that it has quite a lot of all the issues that are listed: climate change, impacts on the most vulnerable, environmental crisis. We know that you're facing flooding at the moment, and then on top of that, COVID. How is that socio-economic analysis that your team, that you're leading your team to do, and organize response around the data that you're coming up with? Ms. Malango.
First of all, thank you very much. And we think that this is a very timely conversation to have. And I want to recognize the colleagues from the Americas who already confirmed that they are online. A couple of things from the Ugandan perspective. First of all, when I look at how we are framing the topic, I really want to start off by saying COVID-19 gives an opportunity to change the narrative once and for all. I agree with my colleague Amjad Abashar that for years we've been talking about DRR. Can we stop and talk about risk and opportunities? It's enough. This is no longer the time of DRR. This is a time when developing countries are doing a balancing act of managing persistent risk, of managing the impacts of global risk, and of trying to transform them into opportunities for their nations. That's the conversation. If you look at it from that perspective, then the risks that a country like Uganda is facing are complex, but they are also a wonderful opportunity for transformation. Uganda has the largest number of refugees in Africa, 1.4. But unlike many countries along the world, refugees in Uganda share villages and homes with Ugandans. There's no camps. So already that as an opportunity where, when you're looking at the COVID situation, we are looking at sustaining livelihoods for the refugees and the 500,000 Ugandans with whom they share their homes, their access to health, their access to education, and their livelihoods. So that is already one aspect that is different. In the past, by now, I would be asking for trucks of water and food to go. No, what I'm asking for is what type of livelihoods can we bring into these communities where most of them are youth, whether they're refugees, migrants, or Ugandans. So that's one example. The other example that I believe is important to bring to the table is that it is time for Africa to start implementing climate smart approaches to economics. Here, again, Uganda and Kenya have started a very good example. We have our cross-border project on Karamoja, where basically we're looking at an indigenous community which exists from Ethiopia through Kenya, through Uganda, all the way to South Sudan and back. A nomadic community whose quality of life was low. So we had an analysis to say, what type of services do these people need? What type of protections do these people need to be able to have a dignified life that doesn't jeopardize their indigenous personality, but improves their quality of life? You start talking about e-learning, you start talking about mobile trade, you start talking about blockchain for the quality of the livestock. So bringing technology into these border areas to improve the quality of life. You talked about the floods in Uganda, but I want to talk about renewable energy in Uganda. Lake Victoria right now is at one of its highest levels in 100 years. That is not just a Ugandan problem, it affects our colleagues in Kenya, Tanzania, the whole neighborhood. So the question is, how can these countries come together and use this water from Lake Victoria to increase the energy available for consumption by their populations? We are producing a lot of energy for factories. Now with COVID, can we produce energies for the small households? two last things that I would like to say before I close on my intervention here. One of the issues that I really want to put on the table today is this, I would say, superficial distinction between so-called humanitarian and so-called developmental assistance. Ladies and gentlemen, we are in the last decade of the Sustainable Development Goals, which call upon us to put people and planet at the epicenter of everything we do, leaving no one behind. If you really look at the most vulnerable people, like we are trying to do right now in Uganda, you will look at what do they need to survive and what do they need to improve the quality of life. It's both humanitarian and development. So I'm looking forward to the conversation that we're having today. It's that this inclusive approach that at least we claim we are all doing and pursuing on helping families, households, and communities to deal with the risk, regardless of what they may be. My last point here is a point on the need for the United Nations, the need for the African Union, the need for all of us to take the youth more seriously as we go forward. In Uganda, last week, we launched our UN emergency. It is targeting most vulnerable. And for time, we had 11 Ugandan NGOs. It was a fight to have them in, and I don't know why. And meanwhile, those 11 NGOs, they include NGOs led by the youth and by women who are close to the community will be. And some of these youth, they have solutions on water, how to take water to the slums and the hard to reach areas, which we all claim is important to manage COVID, to keep the line flat. Some of these youth have invented PPEs that now Uganda is producing. And people are wondering, why does Uganda have only 89 cases instead of the 18,000, which we were told we were supposed to have by now? Because we're using indigenous solutions to respond to the situation, because we're taking preventive measures based on hundreds of experience of dealing with every epidemic on Earth. So if we respect, who form 68% of the informal economies of countries in Africa like Uganda, we have the solutions already with us to be able to continue to mitigate the impact of COVID-19 and make sure that this pandemic is not a curse, but an opportunity to build more resilient and smart economies across Africa and across the world. Thank you.
Wow, Rosa, thank you so much. I mean, the reason I also insisted that we have our speakers on video is to see that passion literally rubbing on us as you speak about risk and opportunity. You've literally given us an idea on what the next conversations should be framed as, looking at risk as an opportunity for us to find solutions. I feel totally inequipped to even go through the number of issues you've raised, but I will try and come back towards the end and just recap some of the things that you've mentioned that hopefully we should take forward in our conversations. Thank you so much for highlighting the component of partnerships as well with the young people, the youth, the non-UN and non-governmental organizations, the NGOs that are really at the front line of developing solutions, working with the communities, and using that indigenous knowledge to push the continent forward in finding solutions. And talking about partnerships, I just want to get now and shift from that very inspirational conversation, Rosa, to the Mali government. Monsieur Fanta Madikone, bienvenue. Et vous, please take charge now and talk to us about the coordination happening at the Mali government level to respond to COVID and other issues that Mali is facing, but also if you have solutions like Ms. Malango has taken us through, please enlighten us. Monsieur Kone.
Okay, merci. Good morning for all. But I read my intervention in French, if you agree.
No problem.
Okay.
No problem.
Ok. Pour la République du Mali, en fait, le gouvernement de la République du Mali a mis en place depuis un certain nombre d'années une plateforme nationale de réduction des risques de catastrophes. Et depuis l'avènement donc de cette pandémie à coronavirus, donc COVID-19, cette plateforme s'est réunie très régulièrement pour assurer en fait le secrétariat permanent et donc donner un élan, une étude sur l'ensemble des crises et contingences au niveau national. Cette plateforme elle est coordonnée par le Premier ministre et le secrétariat permanent est donné au ministère de la Protection civile dont je fais partie. Et il y a eu un décret spécial qui a mis en place un comité issu de la plateforme pour essayer de travailler en étroite collaboration avec le ministère de la Santé pour comprendre et les accompagner sur les mesures à prendre et tout ce qui doit être fait par rapport à la situation de la pandémie. Mais en marge de la gestion de la pandémie dans laquelle le ministère de la Santé fait beaucoup d'activités, nous, au niveau de la plateforme et au niveau de la protection civile, nous avons entamé à travers le pays un certain nombre d'actions, notamment la désinfection des lieux publics, les marchés, les autogares, les services publics, pour voir comment est-ce qu'on peut réduire substantiellement les risques à travers le pays. Et donc, comme le Mali a une situation spéciale, nous avons non seulement le Covid, mais nous avons également les mouvements des populations, des personnes déplacées, et également nous avons une crise sécuritaire donc qui est sans précédent également, qui fait qu'il y a des zones dans lesquelles on n'a même pas très accès à cause des mouvements de terrorisme et autres. Et donc, depuis ce temps, donc, nous essayons de voir, surtout nous sommes au mois de mai déjà, comment est-ce qu'il faut préparer les autres contingences, notamment les inondations, notamment les mouvements de population, les déplacés internes, qui de plus en plus le nombre augmente, soit par le terrorisme, soit par le terrorisme, soit par les désastres liés aux inondations et autres. Et actuellement, nous sommes très actifs dans la préparation du plan de contingence multirisque au niveau régional, au niveau communal, au niveau local, mais qu'on va également compiler au niveau national pour préparer les inondations. Surtout cette année, la pluie s'annonce très bien selon les prévisions de la météorologie. Et dans ces actions-là, effectivement, nous avons des partenaires qui nous appuient beaucoup, notamment pour les séquences régionales. Nous avons nos partenaires de Pierre Phare qui nous accompagnent sur quelques régions, mais aussi des partenaires comme la Banque mondiale, la BID et compagnie. À cause du COVID-19, certains grands partenaires comme le PNUD ont disparu. L'UNICEF ont quasiment disparu et donc nous avons quelques difficultés à pouvoir mettre en place des campagnes de sensibilisation comme nous le faisons habituellement. Dans le contexte actuel également du Covid, nous avons préparé des messages de sensibilisation dans plusieurs langues locales et qui sont en train d'être diffusés sur les télévisions et les radios de proximité pour qu'on puisse atteindre le maximum de personnes à tous les niveaux. Au niveau du Mali. Mais malgré, donc, comme je l'ai dit, ce contexte difficile, la DGPC, donc la Direction générale de la protection civile, qui est un acteur clé dans la prévention.
Did we just lose Mr. Kone there? All right, I'll take over right away because I think he's lost his connectivity, but I'll just want to say we recognize that not all our participants speak French, but the beauty of Africa is that it's a continent of many languages, and so French is one of those that we had to obviously include the voice of our Malian government counterparts to be on the panel. Just briefly, what Colonel Madi Kone has highlighted is that the government Department of Civil Protection that's charged with leading disaster risk reduction and disaster management in the country is working with partners. They have activated contingency planning in 10 administrative regions of the country, and revising the national disaster risk contingency plans is underway. Do correct me along the way for the fluent French speakers. He also takes note that there are challenges that remain, in particular with the regional committees, to have them look at the contingency plans and ensure that the risk planning is multi-hazard. He thanks the partners, including the World Bank, the Islamic Development Bank, OCHA, UNICEF, and Partners for Resilience that work with the government at the local level. Hopefully that captures it. And I know, Diarra, you are obviously better equipped to do the translation. But because of the time limitation we have, I will come back to that conversation of Colonel Kone towards the end, again, when we pick on the questions. But Monsieur Kone, merci beaucoup. Thank you so much for sharing your views and the Mali experience with us. Talking of solutions and response at the local level, is Kai back online now? Maybe I should turn back to you, Kai, so that we don't lose you completely. I'll come back to the local response maybe after we hear some perspectives from you at the African Union level.
Yes, I'm back, Sandy. Thank you very much. I think we had technical issue. I could not hear Amjad, but finally I could follow the presentation. We are discussing a very, very important issue in light of this current crisis. Sandy, we are in a typical crisis, and in a typical crisis, there is, that human element in us. Everybody wants to be part, everybody wants to do something. And also, there is also, that element of control and power. Someone would like, to show fame at the same time. And of course, we also have an element of confusion. All these coupled together create a sort of silos in addressing this kind of crisis. And we have seen that. I mean, it is for good reason. We have seen that everybody wants to be fat. Everybody wants to play a role. And in this case, we also want to play a role, which is very important. But also looking at existing situation. The UN representative in Uganda just mentioned it. In East Africa, we have the flooding. We have locusts, invasion. I mean, these are issues. Even if you try to prevent somebody from dying from coronavirus, and then you have the same person being killed by flooding or being killed by hunger. So it does not serve any purpose, in this case. So we have to balance. And again, looking also at this current situation, we are, the national resources are also, they are also constrained. There is limited physical space. So how can we work within the limited resources that are being mobilized for COVID-19 to also respond to other disasters? Because at the moment we have seen flooding will create mass movement of people. And this also compromises the prevention of COVID-19. So these are the cuts within the limited resources that we have through the COVID-19. We also need to utilize the same port and respond to current disasters within the context of COVID-19, because you will also be preventing new infections, because you have people being displaced by disaster, like flooding. So preventing flooding using the same resources for COVID-19 also allow us to prevent COVID-19, is spread. At African Union level at the moment, we have two ways of response. The first one is the public health. We have the African Center for Disease Control, and so far you might be aware of this. Yeah, it's taking lead. And the Africa CDC has been distributing equipment and supplies to many African countries. Also, we have been doing trainings to public health experts. Also, on the other part, we have created a fund for COVID-19 at continental level. We call it the COVID Response Fund. And so far, the African Union for the last 2 weeks has mobilized $60 million. That is from the member state, revenues. We are looking also for partners, to contribute to those funds. So these are the kind of efforts we are doing at continental level. We are also doing non-public health response. We are currently formulating a multi-sectorial programs that will respond to social impact, economic impact, and other impacts of COVID-19. In this current situation, we are in a three kind of dynamic. We have the ongoing hazard that has to be prevented. We also have an infection that has to be responded to. And then we also have the recovery. So at the moment, let us not just focus on responding to the ongoing infection. So from the perspective, we need to play a role. We need to make sure that risk communication is important. And in a place where there are mass population movement, where people are being displaced by ongoing disasters, we need to make sure that the physical distancing, I would call it, is physical distancing actually rather than social distancing. We need to make sure that that aspect is taken into account in our response. We also make sure that we reach the most vulnerable communities. When it comes to using the existing technologies, not everybody has access to television, nor the mobile phones. So we need to make sure that these most vulnerable communities of our continent are also reached. That is not a public health issue. That is a social and disaster risk issue. So we need to focus on those issues to complement the ongoing public health intervention. Of course, we also need to think beyond the current response and prevention. We also need to think of recovery. At the moment, looking at the existing public health, disaster management fund, most of these funds are being depleted. Now, with post-COVID-19, it's likely, the likelihood is high that you'll not have resources to replenish the disaster management fund. So this is a situation, that we also need to think before now. We need to look at COVID-19 as an opportunity, to mobilize resources to respond to the current situation, but also looking at post-COVID-19 to make sure that those resources are also used to replenish disaster management funds. Because as I said, you will have a situation where people are dying of hunger. And you will also have a situation where people are dying of direct flooding and other disasters. So it is the same way, if one person dies of COVID, it is the same way somebody dies of something else. So we need to balance. And I think that is the kind of thinking the African Union is currently putting in place. We are developing multi-sectorial programs. And at the moment, the discussion is still very strategic. Very soon, we will be now coming to partners and member states to make sure that we have this collaborative approach. Thank you very much.
COVID response in relation to the other issues that need to be addressed on the African continent. But also, again, I like that there's that focus on using this crisis moment as a moment for transformation, a moment to look at solutions, but also at the partnerships. And I think it's a perfect segue to turn to Dr. Asha. Mohammed, the Secretary General of the Kenya Red Cross, who are dealing with exactly the kind of situations you describe: flooding, response to issues of displacement and migration, looking at communities that are hosting refugees that are also poor and vulnerable. And yet, as a local organization, and the issue of resources is something I think that needs to be addressed as well. How does then an organization like Kenya Red Cross, Dr. Asha, address these really complex issues? And before you come on board, Dr. Asha, just want to recognize our online audience. We have 216 people online with us. There's quite a number of questions already that have been posted for you, the panelists, to address. One would be coming to you, Kai, but I want Dr. Asha to come in now and look at that local response to the multiple hazards that you described. There's issues on innovation and transforming how the development community is organized. I suppose Rosa could take that, but I'll come back and look at these questions. But I just want to have a quick round from all the panelists to give us their first impressions on the conversations we're having today. Dr. Asha, kindly.
Thank you very much, Tandy, and hello, everyone. I'm honored to be part of this distinguished panel, and really grateful for the opportunity to share the experience of the Kenya Red Cross Society. And I think I come in at a good point after, because I think the issues he has articulated are very much what we actually are facing on the ground. And I would say in Kenya today, we are facing the triple whammy. So we have the COVID-19. And not forgetting that this comes on top of already other many challenges and otherwise. So I'm just even thinking to myself, when we talk about the last decade in terms of SDGs, when we talk about Agenda 2063, I'm really wondering where we are going, because our baseline has really been eroded and is going to be eroded further if we do not do something about it in the next few years to come. But maybe just to start here, Kenya Red Cross, we are a community-based organization all over the country with 150,000 members and volunteers. Most of them are young people, so I'm glad to see a lot of young people also making comments on the chat, because they have a big role to play in helping our country to actually get itself on track. I think in terms of COVID, yes, we are involved in community sensitization with community health volunteers, trying to reach out to the population with the correct messaging. But more importantly, as the Red Cross, we also try to target the hard-to-reach community. This is whether it is the refugee population that you mentioned, whether it is people with disability, whether it's children, whether it's people who are actually living in the hard-to-reach areas, for example, the border counties that are facing other challenges, whether it's conflicts and violence. So this is really, I can say, the place where we like to go, because we say ours is to reach the most vulnerable. So with COVID, those are some of the areas we are working in, but we are also working with the National Committee of the Red Cross, because we believe that the prisons are also one of the very high-risk areas, and so it's important to ensure that we keep prisons free of COVID-19. A big part of what we do as well is co-chairing with the Ministry of Health is the issue of mental health and psychosocial support. And Tandy, for me here, I think this is something we have to acknowledge and accept that it's going to be a long-term issue that we will have to deal with as countries because of, yes, COVID-19, but also because of all these other disasters that we are now experiencing. We have communities that, for example, because of the floods, have constantly been moving in the last few weeks, because where they move to an evacuation center, the rains continue, they have to move again to another evacuation center. Honestly speaking, it is a very dire situation, and you can imagine the effects that this is having on the population. Coming back to the floods, in Kenya today, we are saying 35 counties out of 47 are affected by floods. And if the rains continue, as is predicted, I think we'll be talking about the whole country that will be actually experiencing floods. So how do we manage this in the midst of a COVID pandemic? It is challenging. Today we have 77 camps that have been set up in the country. That means we have people who are in makeshift shelter. We have people who are in schools. And therefore, when you talk about physical distancing, how exactly do you achieve that? And also considering the rains haven't stopped. So even those who are in the makeshift camps have to deal with that situation at the same time. When we talk about you have to frequently wash your hands with clean water and soap, how do we ensure that this clean water can be provided when even the existing water systems have been destroyed? How do we ensure that people can continue even to go to the health facilities to be able to get treatment for other illnesses, those with chronic illnesses, when the roads are being cut off, when the bridges are being destroyed? It is a very difficult situation. So as the Red Cross, we are out in the community, and Tandy, as we speak, I hope people are not looking too much into my video because I am actually sitting in a vehicle on my way to one of the flood affected areas. But because I felt this was a very important discussion, we just had to park by the roadside and say, yes, let's get into the conversation because it's real, and I really feel it's something we really need to look into. So the question of long-term solutions, I think I cannot be overemphasized, but I think you also mentioned some of the questions that some of the participants are raising. Innovation. How can we innovate? Because we cannot continue to do the same things every time. Even for us as the Red Cross, we are saying, yes, we respond, we are fast responders, but we also work in the area of early recovery and also long-term development. And we do not want to also continue to respond. We want to be able to support communities to build their resilience and improve on their livelihood. So we cannot do this if we are always using the little resources that we get to always keep responding. We are involved in provision of non-food items. We are involved in search and rescue. We are involved in food distribution, but we need some long-term interventions to ensure that, yes, we can achieve the SDGs, we can achieve Agenda 2063. On the locust invasion, we haven't seen the worst of it yet. We are actually crossing our fingers because we understand we are just starting. So if it is true that the swarms are still coming out and they are going to be maybe 20 times more than what we saw towards the end of last year, we are already in a situation where food is an issue. Because of COVID, we have a big population living in informal settlements that rely on everyday wage to be able to get their food. So together with government and other partners, we are also involved in providing food to people living in informal settlements. How long can we do that? Secondly, one of the other methods, of course, is cash transfer, which we prefer because we believe it gives people choices, it gives them dignity, they can choose what they want to eat, but also it helps us not to bring people together in a situation for food distribution where they can actually be at risk of transmitting COVID. But if the markets get depleted, then even the cash transfer will become a bit of a challenge. So those are really big issues. So with that situation, with the flooding, many acres of land being destroyed, we have many farmers today in Kenya, more than 4,000 households that we have already registered that have had their farms destroyed. And this will continue if the rains continue. So add on to that, add the locusts to come on top of that and finish the other vegetation that is left. What is going to be the situation in the few months that we are heading into? So with the support of FAO, we are also involved in an impact survey just to ensure that we can be able to assess and see what is the situation in the 19 counties. So I think, Tandy, there are many issues here, but for me, I think one of the things I would like to also raise is what my colleague from the African Union has said, is the issue of integrated approach that is important. Today, everyone is looking at COVID-19. Everyone is looking at COVID-19. Everyone is providing resources for COVID-19. So who is going to provide resources for the flooding effects? It is the same population that is actually being targeted. And therefore, I think we need a bit of a shift to ensure that we can use the little resources that are available to actually address all these issues. In terms of collaboration, I think as organizations, we all need to come together better. Everyone has a niche and every organization wants to work in one sector or another sector. But we have a situation where all sectors are affected. So how do we ensure that we all come together and provide a comprehensive solution and action? But more importantly then is, how then do we continue to invest in DRR and otherwise? I heard Rosa saying that maybe we should stop talking about DRR. But my question is, even how do you even invest in DRR when the interval between one disaster to another is so short that you don't even have time to recover and to prepare for the next disaster? I think I'll leave it here, Tandy, and happy to continue with the discussion.
Dr. Asha, thank you so much for bringing the reality to us again in terms of, I think, the complex issues of disaster risk and responding on the ground. I mean, you're seated in a car, and we're really grateful that you were actually able to block this time and share this really, really important piece of information, but also the example of how you're constantly on the move and reaching out to communities and being at the front line as a local organization supporting governments and communities in responding. A lot of issues raised again between you and Rosa, Kai, the Mali government. I have quite a lot actually right now to go through, but thank you so much. It's also a perfect actually moment to turn to Urian from the Partners for Resilience, as you spoke a lot about integration and looking at a long-term investments into resilience building so that we're not constantly responding and jumping to help people that are really vulnerable. Urian, I want to turn to you now and really find out from an alliance as Partners for Resilience that really focuses on building community resilience to climate change impacts, ecosystem management, the whole environmental crisis that the world is facing. How exactly do you function in a context like this, considering that your focus is long-term response, but ultimately there's immediate needs that need to be addressed? Could you just take us through maybe how Partners for Resilience is operating in today's context?
Yeah, thank you, Tandy. Thank you for this opportunity, and good to see so many colleagues from different places. Yeah, of course, as Partners for Resilience, we are focusing on strengthening capacity for influencing in the domains of risk reduction, climate change, and environmental degradation. And much of that requires sitting down with governments, with other stakeholders, sometimes with communities to learn from them what their risk profiles are in their own places. And much of that work is somehow interrupted because we are unable to sit together in physical spaces. So much of the adaptation activities have temporarily been halted in some of the countries where lockdowns and curfews are dominant. At the same time, however, we do learn, and we are starting to apply all the virtual dialogues such as this one. So I think this is part of the innovation and the change that we are seeing in many places, which will also push for more innovation and new ways of working together collaboratively across different spaces without maybe the physical spaces needed. So I'm very happy to be here now in this virtual chamber with colleagues from the African Union, but also hearing voices of the youth and hearing colleagues who are working on the ground and actually are going to visit communities to learn how they are dealing with this particular COVID crisis and simultaneously floods, and how we can support people in need during those phases. I think what this what I hear clearly is that the vulnerability of poor or already very marginalized groups, like people that are disabled or are already affected by other crises, that this crisis is just showing how important it is to really strengthen the resilience of communities and do that not in silos. And therefore we need to look at how we combine interventions that look at social protection for food security, but also access to sanitation, to water, to basic health. And it also the larger environmental crisis that is of course happening at the same time, and how we can seek to reverse that crisis, because it's just compounding already existing vulnerabilities, and we need to reverse that to actually make ecosystems reduce risks and strengthen livelihoods as well. As an alliance, maybe also to answer your question, since a number of weeks we've started to look at how we can also respond now to the crisis situation. The alliance is made up of humanitarian, development and environmental actors. So we're perfectly across the domains that were talked about before. We can't separate humanitarian, development and environment. This is an alliance that actually brings all those different disciplines together. So we are adapting also and making probably around €1 million available to respond. But also we've said that we want to continue focusing on that longer term resilience strengthening work that is so important. And I'm sure that also this response actually will help also to attract better longer term funding for that resilience work, because I think this is an opportunity indeed, recognizing that vulnerabilities are high and people are even worse off with an additional epidemic like we are facing today. So I think the recognition for long-term community resilience strengthening will be clearly there, and we need to innovate and find new solutions, like working more digital, but finding also more digital engagement tools with people, amongst others the youth, to really engage them into building new solutions to strengthen the resilience of communities. Thank you, Tandy.
Great. Thank you, Urian. I think a lot of issues that are going back to what a lot of the previous panelists have spoken about on integration, inclusiveness, the innovation. I hope Safia Verji, who asked the question on innovation, is somehow getting some answers through these conversations. We have at least 38 questions. We're not going to be able to go through all this. At this juncture, I want to turn to OCHA, the humanitarian arm of the UN. Julie, we just heard Dr. Asher describe a rather gloomy picture in terms of, I think, what it looks like now in Kenya. She mentions there's 77 camps across the country that have been set up to respond to flooding. Now, I mentioned at the beginning that it's probably a scenario we all trying not to think about, but which we are obviously thinking about in terms of preparedness. How is the humanitarian and development community organizing itself to prepare to respond to a disaster that might require international response, given the current context of commercial flights that down? We know that movements within countries are quite restricted. Can you maybe just take us through briefly how you as OCHA are working with governments at a regional body to prepare or just have the right contingencies in place in case some countries require the support from external partners to come in and support that local response?
Thank you very much, Tandy. Can you, I hope you can hear me fine. And I say a big hello to everybody, and especially some of you are former colleagues of OCHA. It's nice and to be part of this group and to be asked to provide a little bit of information on what we're able to do. It's sad to have to bear the news that unfortunately plans for possible international response are already in place, because that response is needed in many of the contexts where we were. Certainly in the region that we cover here in West and Central Africa, we already had 8 very important humanitarian operations ongoing prior to the pandemic being declared. And those operations are responding to the needs that are created by different different hazards, be it, you know, conflicts, climate change related disasters such as drought, floods. Now we are also looking in West and Central Africa at the possibility of a locust infestation, conflicts, migration, just to name a few. So those countries that are already facing enormous challenges had very early on, and I heard Amjad's call for a lot more work on integrating you know, hazards such as epidemics and pandemics to our preparedness work. And we see today that this is actually critical because it does complexify a lot of our work at field level. On countries that may, certainly in Africa, who were already fragile and have seen, you know, some vulnerabilities increasing in the past year, for example. In this region, unfortunately, the food insecurity has increased quite dramatically since last year, and we were forecasting up to 20 million people in a state of food insecurity before COVID actually you know, descended on us. So what, just to be very brief, because I see time is flying, I think on the, you know, the requirement for an international response is always understood as needed when the national efforts, you know, are overwhelmed or are not capable of responding. And national efforts, I'm talking, of course, about efforts from the governments but also local actors. And certainly in the case now, localization is definitely something that is required, that we're looking at very carefully in terms of strengthening capacity and so on. But I think I'm pleased to say that certainly from an OCHA perspective and from a humanitarian system perspective, together with the development partners, for a number of years now, we've been working within, I would say, the DRR framework, much more on a preventive agenda than on a reactive one, and trying to bring to the fore the necessity to have a risk-based approach. There are a number of tools, and you can see OCHA very much as a toolbox, because that's what we provide to the system. We create platforms, we create services and tools that help this effort of being prepared for a multitude of hazards. One of the very interesting tools, I think, that has been used when COVID was looming, and very rapidly, we have something called the Inform platform, which is basically a platform that is giving us is a composite index that can identify the countries that are at risk of different hazards. And in this particular case, we've created an Inform COVID index that was able to to give us a snapshot, if you'd like, based on the different evidence-based sources that are used, of which countries and which populations were most at risk of the impact of COVID, health-wise, but also for the secondary impact. And I think we were able to quickly organize ourselves globally, but also at the national level, when this index was showing a country to be flashing red, for example, such as countries like Liberia, currently Sierra Leone, Benin, and Togo, to then engage in the work of operational readiness. So operational readiness is part of preparedness work. It's ensuring that we have, as your question implied, the plans in place for making sure that we can provide the very important and critical humanitarian assistance to save lives where it's needed. So I think, just to say that for us, the most important messages and the lessons from the past, and those are drawn also from the Ebola outbreaks, both in West Africa and in DRC, is that the good preparedness really is when you can capture the potential impact of different hazards, because it will definitely tell you who is most at risk and who will need the assistance, who are the most vulnerable out there, and in a holistic way, as many of the colleagues have presented before. I think it's important to see and the role of institutions and functions such as ROSAs, as RCs, to ensure that the different parts of the system are working together to address in a more holistic way the needs of people, and not seeing it as compartmented in food bags or blankets or different items that might be required, but what populations and people who are in a state of facing shocks that are making them increasingly vulnerable and very close to being in a state of life-saving need.
Great.
To make sure that we do provide them with the right assistance. So yeah, just I see the time is flying, but
yes,
we do have currently a global appeal that is also reflecting some of those needs. So all the system working together to really look at the best conduits to make sure that the needs are covered. So we're doing our part.
Great, thank you, Julie. Thank you so much. I think what I neglected to mention is that Julie is the head of the OCHA regional office for West Africa and Central Africa, and so that context that she brought to us covers that wide geographical space within Africa, including the issues she makes mention of. You speak about preparedness, and I think it's the perfect way. I will turn to Papa Zuma Diarra, who's with the Africa Risk Capacity. Diarra, you've heard so much conversation around the need for preparedness, and having organization not be in this reactive mode. And those are some of the comments that are also appearing quite frequently on the chats with our participants, who are saying the UN, the AUC, the Red Cross, you all need to change how you're working. So they are challenging us to say, yes, nicely said there, but can we actually change the way we function to ensure that we're not perpetually in a reactive mode? And the examples that have been given, I think, have provided some clarity to some of those questions and concerns. But Diarra, on the issue of disaster risk insurance, we know that there's been a slow uptake of this initiative by most African governments. And I really don't know if it could have been applied in this context of COVID, where we are seeing that millions of poor, vulnerable people are going to be impacted. How can the risk insurance capacity to disasters be optimized as an opportunity in this moment of crisis for the world, not just Africa? Diarra.
Okay, thank you very much, Tandy. And really, I'm very happy to be part of this important discussion within the context of the COVID-19. So, in fact, as you know, yes, African Risk Capacity, which is a specialized agency of African Union, is bringing a solution that provide an effective and efficient layer of protection to its member state when they are facing disaster. So today we can see the organization risk pool has been steadily growing, because its risk pool has over the recent year expanded with the growth of its product that is offering to the member state. And we are also trying to aid outbreak and epidemic coverage, which will aid some kind of a diversification to the risk pool, which could be which could generate sort of reinsurance efficiency for the facility. So the ARC, as a parametric sovereign disaster risk insurer for African nation, is planning to aid coronavirus protection to its planned outbreak and epidemic parametric insurance product, so which aims to be available by 2021. So they work to develop a protection product based on a parametric index to support, let's say, outbreak and epidemic insurance and risk transfer at the sovereign level, and backed by global reinsurance capital, has been underway since 2016. But given the outbreak of the current COVID coronavirus pandemic, the African Risk Capacity is now planning to aid the coverage for coronavirus outbreak to its offering, before it launch. And so with the addition of the coverage for future coronavirus outbreak, it will be interesting to see whether ARC can make this happen in an affordable and economical way, as the insurance cost, may be significantly higher, definitely given the current crisis. So, as I say, it will be launched, for cover starting by 2021, knowing that initially it was covering Ebola, meningitis, Lassa fever, but given what's happening now, we are really modeling to include coronavirus. On the other hand, also, I can say ARC, as a specialized agency of the African Union, is also undertaking an urgent exercise to model the potential impact of the coronavirus in Africa, so which will allow to inform and guide member states in somehow. So this modeling will look into likely short-term and medium-term effect of the pandemic on the continent, as well as how to mitigate those shocks. So our aim somehow is to develop really a customized response, preparedness model based on real-time data reflecting African realities, and being mindful that our population, today are also vulnerable to other natural disasters such as drought, that really threatening, food security. Of course, since its start in 2014, ARC has launched like 6 insurance pool for the member state, from 2014 to 2019. So ARC cumulatively provided drought insurance coverage, definitely worth 600 million to around 60 million people in its member state. That during this period, ARC paid the government of a different member state, namely to name few of them, Senegal, Mauritania, Malawi, Niger, a cumulative amount of $60 million to support approximately over 250 million people affected by drought. So more recently, the drought in Senegal, Cote d'Ivoire, and Mauritania in West Africa in 2019 triggered a combined payment of more than $25 million to those countries. So in addition, in East and Southern Africa, Zimbabwe, Madagascar will receive also at least, let's say, 4 million in the coming weeks to cope with the effect of drought. So there's affected population that are receiving the necessary assistance, not only to address their food security need due to drought condition, but also to adapt to the compounding threat imposed by the economic and social constraint of COVID-19. So the response approach with ARC payout today takes also into account responses already ongoing to address the effect of the pandemic, the COVID-19 pandemic. So as some of the speaker mentioned it, of course, many African countries continue to face multiple disaster risks. So the impact of combined, of which combined with the coronavirus pandemic could be really devastating for those countries. So for example, drought, flood, major tropical cyclone in a number of African countries affected by the coronavirus could lead really to a crisis and further loss of life and livelihood. So, and ARC really seek to bring solutions that provide, again, as I say, effective and efficient layer of protection to the member state through the insurance mechanism. So I can say the insurance really pays off because, some early resources has been provided to member states. Definitely with this current situation, the country are operating within a limited budgetary constraint, however, the potential impact of those other risks such as drought are really real. So therefore, we continue to offer insurance coverage for drought risk and other products as well within the context of COVID-19 pandemic.
Great.
Thank you very much.
Diarra, thank you so much for that update. It's quite positive to hear that there's been some payouts already to countries that can also use those finances in the current context of COVID response, but overlaying that with other issues of food insecurity. Now, I know that I have already kept all of you beyond the time that we had requested for. I apologize, but you can see the hunger in the chat box is crazy. I don't even know what to do with that. The questions are immense. There's a lot of demand on asking for transformation in the way the AU, the UN, the Red Cross movement, the NGOs are responding to ensure that we put vulnerable people at the center of response and the focus also on preparedness. But I want to just say thank you so much to our 200+ participants, to you, the amazing panelists. What we will do is to go through the questions, synthesize those, and include them in the report that we're going to send out. And hopefully we will highlight which components are supposed to be targeted at your particular offices. I think it might be better that way, so I don't abuse my my right of having you here, so that next time I send a request, you don't say no. I want to thank you so much. I'll just end by really highlighting 5 key points. COVID gives us an opportunity for transformation. Rosa, you might hear yourself in these some of these comments, but I think everybody somehow did come back and refer to some of those issues. Risk and opportunity, I think an opportunity for us together with UNDRR and the African Union as we move forward in organizing a series of these webinars, that we consider risk as an opportunity going forward, including how we frame the themes of these webinars. Climate smart approaches links to what Urian talked about in terms of climate adaptation and the environmental crisis, and the focus on livelihoods as well for the people that are most affected. The most vulnerable and an inclusive approach, ensuring that we're not looking at COVID alone, but looking at all the other sectors, has been prioritized as well and emphasized as well by a lot of our online participants. And the voice of the youth, we have to make sure, and I want to make sure that in the next conversation, we will have somebody representing a youth voice to tell us exactly some of the solutions that they bring to these conversations. The indigenous knowledge component, fantastic, because we know that science is not just in the lab, it's existing at the community level and in the communities that are using indigenous knowledge to find solutions. And also the aspect of integrated approaches, but also using insurance as a preparedness scheme. And so I want to thank all of you for being here. I wish you a good day, be safe, and we hope to talk to you in the next webinar. Thank you.
Thank you, Thandi. Thank you, colleagues.
Thank you very much.
Thank you. And have a good day.
Thank you.
Thank you. Thank you,
everybody.
Rosa, take care.